Today we're going to have a discussion about pain on the outside of your elbow, sometimes referred to as tennis elbow. This is a common condition that can affect 1 to 3% of the population. It is also the most common cause of persistent elbow pain. It affects both men and women equally, and those affected are mostly between the ages of 35 and 54. If you take a look at this model here, you can see that there are 3 bones that make up the elbow complex. These bones are the humerus, sitting closest to your shoulder, and then your radius and ulna that sit between your wrist and your elbow. Muscles that help straighten your wrist and fingers come from this bony part of your humerus and travel alongside your ulna and radius to attach into the wrist or hand. You can see some of the muscles on the screen now. Some of these muscles can help with grip and also turning your palm up towards the ceiling, which is called supination, in addition to help straightening out your wrist and fingers. As you can see on this slide, muscles are attached to bones by tendons, and these tendons are made up of collagen fibers. Sometimes, if you do too much of an activity or have a sudden increase of load through one of your tendons, they can get irritated as the balance of creating and degrading collagen fibers, which happens all the time in healthy tendons, is disrupted. This can lead to overall degradation of the tendon and pain in the outside portion of your elbow. You may notice this pain, especially when holding a prolonged position or doing a movement that requires the use of the muscles affected, such as gripping or straightening out the hand or fingers. This condition is sometimes called lateral epicondylalgia, although you may have previously heard it being referred to as lateral epicondylitis. This name has been altered to better reflect the nature of the condition as a breakdown of collagen in the tendon, rather than an inflammatory process as previously thought. Now, what to do about it? Although you may feel like complete rest makes your elbow feel better, when you start going back to an activity, it can bring all your symptoms back, resulting in further pain and frustration. This is because while you may have avoided the activity giving you pain, you may not have been able to help the tendon become more robust. Tendons like to be loaded or worked, and by using particular strengthening exercises, you can reduce your pain while allowing your tendon to get stronger. Which particular exercises would be best can be suggested by your physiotherapist. While tendons do like to be loaded, we do need to be careful that we are loading them at an optimal level. This means that while it is okay to have some pain during exercise or activities, if this pain exceeds a 4 to 10, activity modification will be important in ensuring that we are not further aggravating the tendon. You will want to be thinking about this pain threshold both during the activity and for 24 hours afterwards to see how your body reacts. Importantly, if you do accidentally aggravate your elbow, this does not mean you must stop all activity, but rather you just need to find the right level for you at this time, and this is something we can help with. Tendons can take some time to return to their normal level of functioning, so we would be looking at around 12 weeks for complete recovery. During this process, you will continue to get stronger and experience less pain. However, it is important to keep up with your rehabilitation through the whole process to get your tendon to a robust state where they can cope with the demands of the things you love and want to get back to doing. In the meantime, ice can give some pain relief, as well as modifying those activities that give you more pain than mentioned above.